assessment tool. OSCE offers an attractive option for assessment of students' competency. It provides strength in terms of staff, objectivity, and reliability of the assessment process for all the students, especially when compared with other methods of assessing practices. And really, it's true during this pandemic situation. A strong, motivated, illustrious, and a good soul who clearly outlines expectation for staff and students makes to explore. This is an ode for our principal, Dr. Padmavati. My heartfelt welcome to you, ma'am. If one takes a closer look at the alchemy of life-achieving person, two distinct pop-up, perseverance and hard work. And these are pioneering spirit and willingness. Here we have an acclaimed resource speaker, Dr. Judy Arulappan, today, who is the living idioms with knowledge and wisdom. I welcome you, ma'am. Once again, I'm welcoming you all to this mind-blowing webinar. Thank you all. Thank you all. Now, our principal, Dr. Padmavati, will give a brief introduction about our distinguished resource speaker. Thank you all. Thank you, ma'am.
Thank you, ma'am. Thank you. Ma'am, visible இருக்குங்களா? Is it visible? Screen is
visible.
Yes, ma'am. Yes, ma'am. Okay. Okay. Good afternoon to one and all. It's my privilege and honor to introduce Dr. Judy Arulappan, our speaker of today's webinar. To you all, it's my honor, I can say that. So we have her pages are very more actually regarding her achievements and other things and all to say about her CV. But briefly, we have somehow cut short it, and we will try to finish it up within 5 to 10 minutes. Okay. So now our speaker is Dr. Judy Arulappan from HOD of Department of Maternal Health Childhood, College of Nursing, Sultan Qaboos University, Al-Quds Sabit, Sultanate of Oman. So regarding her madam's academic credentials, madam has completed her UG from Tamil Nadu Dr. MGR Medical University and PG from Savita University and PhD from Tamil Nadu Dr. MGR Medical University and Doctor of Nursing Science from Italy University. And regarding her other credentials, madam has completed her CGFNS, IELTS from British Council and IELTS General Academic from British Council and IELTS General from British Council and Oman Promet examination from Oman. And also regarding her professional experiences, madam has started her career as clinical instructor from Savita College of Nursing and continued as lecturer from there itself, and also started her career as professor at Apollo College of Nursing and continued there for 4 years and took the principalship of Maitri College of Nursing from Karnataka. And after that again came to Tamil Nadu to Vale Oris College of Nursing as principal and again joined as principal. She has been worked as principal for 3 College of Nursing actually. So I'm glad to say here that I worked under madam's guideship for 1 year as vice principal at Triple M College of Nursing from 2011 to 12 actually. After that, madam has gone to pursue a higher post of Dean of SRM University. And from there, she moved on to be her service has been rendered to all over India. And again, she started to serve the overseas country also. She took over the post of assistant professor at Sultan Qaboos University College of Nursing. And there, madam has also promoted as head of the Department of College of Nursing, Sultan Qaboos University, Sultanate of Oman. And regarding her additional qualification, madam has undergone short training courses at Library Database Management, EndNote, SPSS, training on Moodle, NIH web-based training course on protecting human research participants, NIDA Clinical Trials Network, and then Turnitin Management, ASCII Training Forum. And academic writing, online questionnaire development, online quiz, Moodle, examination standardization process, student outcome assessment, plagiarism, qualitative research, community of practice development, critical thinking. I think most of us will not have even heard about certain qualification what madam is having actually. We will not have been aware of that, but she is always she has the knowledge thrust actually. And till the end, she always uh, strive hard to learn actually. So that is the reason she has done so many courses, training courses. And regarding Madam's merits and awards, she has obtained Outstanding Scientist Award in Childhood Nursing from Venus International Foundation and identified as SKU Pure Expert in SQ Active Research's Elsevier database, and also received Book Publication Award by Honorary Chancellor of SRM University, and Excellence in Nursing Research Award by SRM College of Nursing, and Best Nursing Initiative Award by Sundara Medical Foundation, and Best Woman Leader Award by MMO College of Nursing, and Best Teacher Award by Tamil Nadu Dr. MGR Medical University, and Young Achiever in Nursing Award by JB Educational Trust, and Lifetime Achievement Doctorate Award by Sri Ramakrishna Institute of Paramedical Sciences, and Rashtriya Vidya Saraswati Purushkar conferred by International Institute of Education and Management, New Delhi, and Best Teacher Award by adjured by students of Apollo College of Nursing. And Madam has also obtained a distinction in MSc as well as PhD nursing programs. Regarding her professional memberships, she holds the membership as Vice President of Nursing PhD Society of India and Life Member of Indian Science Congress Association and Life Member of Nursing Research Society of India, Life Member of Christian Medical Association of India, Life Member of Catholic Nurses Guild and the Tamil Nadu Nurses and Midwives Council Nurse Midwife Numbers, and Life Member of Trained Nurses Association of India, and Member in Public Health Education and Research Consortium, and also International Network for Health Workforce Education, and also member of Women Cancer Foundation, member of National League for Nursing, and member of Phi Gamma chapter of the Honor Society of Nursing, that is Sigma Theta Ta. And Madam's other credential, Madam has also authored many books, and also she has authored many chapters, and also she has been as advisory panel in writing the book services, and also she has reviewed many books as well as many of the national as well as international journals. Madam is the reviewer as well as peer reviewer for many of the national as well as international journals. And regarding her research activities, research, she always encouraged the student, including me. She used to encourage all of us to continuously do some research projects, and we have to get the funds like that. Always Madam used to encourage us. So regarding her research activities, Madam has received grants as principal investigator for 11 projects and grants received as co-principal investigator for 6 projects. And she ongoing funded project is 1 and ongoing non-funded projects are 6. Now at present under Madam's books are going on. And also she has guided 40 MSc Nursing dissertation and 70 PhD dissertations, and also PhD adjudicated are 14 and guided PhD Nursing research projects 36 and done 92 publications and public review 21. Regarding many of the, she has organized as well as conducted as well as participated and has been resource person at various national as well as international seminars as well as webinars, and holds the membership in almost membership in committees like 18 areas. She holds the membership in ad hoc committees 13, and guidelines developed. Madam has developed 3 guidelines and coordination of international student activities 3. And regarding her co-curricular activities, she holds the position of Vice President of Nursing PhD Society and member of the Indian Science Congress Association and steering committee member in the Asia Pacific Bioethics Network for Education, Science and Technology, and NSS coordinator, YRC coordinator, Red Ribbon Club convener, Echo Club convener, SNA advisor, member in ResearchGate, member in LinkedIn, and member in Google Scholar, and member of academia.edu, and etc. Okay, so looking into all these things, we can say that each and everything, if Madam does a small thing also, she does with love and interest. The interest as well as the commitment, the passion she shows towards that particular event is really appreciable by everybody. It should be encouraging and it will be motivating to others also. You can just see the room what she is sitting now also, how nicely she always has that kind of aesthetic sense. Actually, she always looks to be very pleasant, and she keeps her area neat and pleasant, and always keeps the people keep running. Actually, she will be keep on guiding the individuals to work for a cause actually. So if we are under the guidedship or leadership of Judy ma'am, means we can somehow run the race actually. We can run and win the race. So that is the special quality of Dr. Judy Arulappan, and I'm happy and I'm glad she don't even misses a small game also which is organized by uh, Teachers Day celebration. I have been with her, no. So even for the Teachers Day celebration also, I will not be able to participate. I said I have breathing difficulty, I have back pain, I cannot participate. But madam will be the first person whenever the student requests, ma'am, there is the game for the teachers, you all have to participate. The first person will be volunteering will be our Dr. Judy Arulappan. So she is always appreciated by the students for this energetic and encouraging involvement in all her activities what she does. So I'm proud, and I'm proud that today she is honored by her presence to all of us. And also I'm proud that I have been under her guidance and under her leadership. Thank you, ma'am. With this small introduction, we have so much of pages where there actually, and our vice principal able to cut short it somehow, and we were able to present to you also. Thank you so much, ma'am, for being with us and for sharing your knowledge. Thank you, ma'am. Over to you, ma'am. Ma'am.
Yeah. Thank you, Batu.
Yes, ma'am. Yes, ma'am. Okay, ma'am. Ma'am, ipo neenga share pannalam, ma'am. Thank you, ma'am.
Okay,
thank you for coming, ma'am. Thank you so much, ma'am.
Thank you, Batu. So a very happy and pleasant good afternoon to everybody. I'm really happy and honored to be here today in the midst of you all. And I really thank Batmavati, I call her Batu. So I thank Dr. Batmavati for inviting me, and Chitra for inviting me today for this webinar. Batu, thank you for your words. I'm really happy, humbled and honored with your words. And it's my pleasure to be associated with you. And I'm sure that I will be continuing to have the association with you all.
Yes,
for any kind of professional activity, I will definitely continue. Thank you so much.
We will be grateful, ma'am. Once you come back to Chennai, India, please visit us college also, ma'am. We will invite you.
Sure, Batu. Thank you very much. Thank you, Chitra. Chitra is she was my old student, but we became good friends actually. I like her from the student period. I do not know. I am very much attached to her, and from the day I met her in Savitha College of Nursing long back in '96, till today, she's the one who is continuing her friendship with me. So I don't feel that she was my student. She's my friend, I feel always. And thank you, Chitra, for inviting me today. Thank you very much. Thank you, both of you, Batu and Chitra. Let me start my presentation. I will share the screen.
Yes, ma'am.
So it says you cannot share the screen. Can you, Batu, remove the? Can you please?
Yes, ma'am. Yes, ma'am. I stopped sharing. Yes, ma'am. Just a minute.
I think now it will open. I think. Okay. Is it visible? Is my screen visible to everybody?
Visible, ma'am. Visible now,
ma'am. Okay.
Fine. Okay, I'll start. Okay. So again, a warm good afternoon and a pleasant welcome to everybody who have joined for this webinar. I am Dr. Judy Arulappan. I am assistant professor and head of the Department of Maternal and Child Health, College of Nursing, Sultan Qaboos University, Muscat, Oman. These are my contact details. So I can be contacted in my mail, as well as I can be contacted in the mobile number where I am available in WhatsApp too. And I always believe in sharing knowledge ensures entry of new, because that is my philosophy in my life. Because I always feel that whatever I know, I should share that knowledge to others, so that it is a growth for me. It is not the knowledge, whatever I gain, it should not be limited to myself. It should be communicated to others, so that everybody will be benefited. And moreover, our younger generation, our novice nurses should be gaining the knowledge, so that they will be able to be good products of our society in future. Therefore, my philosophy is sharing knowledge. With that start, I would like to start my presentation. So I always put this for my novice nurses, because I want our nurses to be publicly noticeable. So that should be our nurses should be known to everybody, because as nurses, we have a lot of potentials, but we don't share our potentials outside. So therefore, I would always say my juniors or my students as well as my followers, whoever it is, may ask. I always tell them to follow by publicizing or by making yourself visible to the society. So that means your profile should be visible to the society so that people can utilize your knowledge, your resources, and it will be useful for everyone. Therefore, I can be followed in Google Scholar. This is my Google Scholar account. This is my LinkedIn account, ResearchGate account, OSCE, Scopus, SQ Research Profile, Mentally, Twitter, Facebook, Publoons, and Web of Science. Because I have made myself available in these platforms. Therefore, whatever I am doing, I can publicize my work to the society, so it will be publicly available to everybody. That is the reason I am just putting this for your information, just to encourage all of you to have your own accounts, so that every one of you will be visible to the society. Because I always tell everybody, we are born in the society for achieving something. Because when we are born in the society, we are not, God has brought us to this society just to produce something, because we should be really useful to the society. Therefore, this is the introductory note for all of you. Just please start working on your public profiles so that you can be visible to the society. And I personally thank the organizers, Dr. Padmavati Kamaraj and Miss Chitra, the principal and vice principal of GRT College of Nursing and School of Nursing, Tirupati, Tamil Nadu, India. And I always start my presentation with a virtual tour to Oman, because this is the country where I'm living now. And I am really thankful to this country for giving me a chance to work for this organization. Therefore, I always start my presentation by taking the participants to a virtual tour to Oman. And moreover, it is a post-lunch session. Therefore, nobody should sleep. So this is a very quick virtual tour to Oman. This is the country where very beautiful country with lots of hills and mosques and very, very beautiful buildings and nice sceneries. And these are the old buildings of this country. And this is a country full of dates. We can see variety of dates in this country, and very greenery, beautiful greeneries and sea, and beautiful sea. Look at the sea. And this is the university where I'm working now, Sultan Qaboos University. And this is the university campus. And we call it as Clock Tower. And this is our university campus. And this is the mosque in the university campus. And this is one of the building or one of the college in the university. And this is the College of Nursing where I'm working now. And these are our College of Nursing faculty. We have around 58 faculty in our College of Nursing. So we have a bachelor and master program in our College of Nursing. So this bachelor and master program is done by 58 faculty members. So this is the faculty strength of our college. So the faculty are from various countries, from international faculty are working in this organization. And this is our department where I'm heading now. This is the Department of Maternal and Child Health. So there are around 18 faculty in our department. So these are our department faculty members. I am really happy to work with our department faculty members. And this is the simulation lab experts. So you can see the simulation lab experts right from the right side. So they are graduated from US. And so this is about their simulation lab experts, because I really want to acknowledge them. And because we are learning many things from these simulation lab experts. So Batu, I am getting some lines in the desktop. Can you see that? I'm getting some lines over my presentation. I do not know what is this. Somebody is drawing some lines over the presentation. Can it be removed? Okay. So let me start the presentation. Clinical experience through simulation and evaluation through OSCE. So this is the outline of my presentation.
Ma'am, hello. Ma'am, sorry, ma'am. The students yaro just announce panla ma'am. Students, please don't do anything with your screen. Edavadhu panna inge it will reflect actually. Dear students, yes, ma'am. Students yaro appadi panna appadi varum ma'am actually. Ellaroda screen limit is disturbing actually.
Oh, it is really disturbing my presentation.
Dear students, please check you're not disturbing your screen, touching or something, so it will disturb the whole presentation. Kindly avoid that.
Because I am unable to present because so many lines are there.
Yes, ma'am. Yes, ma'am.
So This is the outline of my presentation. I'm going to present to you about the core concepts of simulation, the benefits of simulation, types of simulation, planning, implementing, and evaluating simulation, sample simulation scenario, what we are using in university, and INASC standards of best practice, and OSCE as an evaluation strategy in nursing education, sample OSCE template, best practices in our university, and my own experience in simulation and OSCE. These are going to be my presentation today. So I will quickly go through it. And but this session is not going to be a theory session. It is going to be more of practical session, because whatever I have learned and whatever we are incorporating in our university, I am trying to present it to you to understand it in a better way. So usually, I just wanted to say that we always follow the student learning outcomes whenever we are whenever we are planning for our clinical learning activity or lab learning activity, or whether it is simulation or whether it is clinical learning activities. So these are the 8 student learning outcomes we are expecting from our graduate nurses. So same way, I'm very sure that all our Indian colleges also will be having the student learning outcomes similar to this. Therefore, because it is the international benchmarked student learning outcomes which we are following in our university, because our university is accredited by ASN, American accreditation agency. Therefore, I am just projecting it for your information, because all of us will be following similar objectives. We will be expecting similar objectives to be achieved by our nursing students. So it is expected that after completion of the study program, the graduate shall be able to integrate knowledge from various courses into nursing. Because why I am highlighting this specifically is because all these 8 student learning outcomes are integrated into the simulation scenarios. Whenever we are applying some simulation or OSCE, we make sure that all these 8 SLOs are integrated into the rubrics, so that we are able to evaluate the students comprehensively, and we are able to we are able to understand whether the students are achieving these objectives or not. But really, it is disturbing me. The lines are really disturbing me. Somebody is disturbing the presentation. I do not know who is that. I'm really disturbed with the lines. Somebody is really disturbing. Chitra? Chitra? I don't know. Somebody is disturbing, Chitra. Unmute yourself. Unmute yourself.
Ma'am, hello. Good ma'am.
Yes, Batu. Now I am projecting it
Ma'am,
again.
can you hear me, ma'am?
Yeah, I can hear you, Batu.
Yes, ma'am. Risha. Yes, ma'am. Ma'am, technical people work பண்ணிட்டு இருக்கேன் ma'am. Engineer.
Is it visible, Batu? Is my screen visible now? Batu? Is my screen visible?
Ma'am, இப்போ screen visible, ma'am. Screen visible, ma'am. Full sheet.
I will continue. I will continue.
Yes, ma'am. Yes, ma'am. அதான் ma'am, அங்க work பண்றாங்க ma'am. Technical people working ma'am. அதை எப்படி clear பண்றதுன்னு சொல்லிட்டு. Students usually அந்த மாதிரி பண்ணுவாங்க ma'am. Actually, when we do also. Yes, ma'am. Now I send the message to all. Yes, ma'am. Visible again starting, ma'am. Yes, ma'am. ஒரு எப்படின்னு தெரியல. எங்க டீம் எல்லாருமே தான் உட்கார்ந்து இருக்கோம் ma'am. We are doing ma'am actually. Engineer வந்திருக்காரு ma'am. அது எப்படி கேட்டுக்க. Sorry ma'am. Sorry ma'am.
No problem. No problem. I'll continue. So usually the student learning outcomes, we expect the students to integrate the knowledge from various courses into nursing. That means when we are giving a simulation scenario or OSCE scenario, we make sure that the students are integrating their knowledge from various courses they have learned in the nursing program. And they should be able to provide ethical nursing care to individuals, families, and community. Whenever a simulation scenario is provided to the students, they should make sure that they are providing ethical nursing care to the patients. That means they should consider the ethical aspects, as well as they should consider the culture, and they should be providing nursing care to the patients. And also the students are expected to ensure safety in the delivery of nursing care to the individuals, families, and community, because safety is the main concern. So we will be integrating safety components into the simulation scenario, and we will see whether the students are able to identify the safety issues and should be able to rectify that in the simulation. And also we make sure that the students are adopting evidence-based practice in the care of individuals, families, and community. So we also will be integrating some evidence-based practice component into the simulation scenarios to make the students to pick up that part. Also, the students are expected to demonstrate leadership and team skills in the healthcare, so that the simulation scenarios are constructed in such a way that when there is a situation to call a doctor, the students are expected to call a physician and get an order, or the students are supposed to call a head nurse and inform if there is something going wrong. So in this way, we expect the students to apply the leadership and team skills when they are providing healthcare, and the students are expected to communicate effectively with the patient, family, and multidisciplinary healthcare team. So we also expect the students to communicate with the patient, the family members, as well as the other healthcare team members, as well as it is mandatory the students should be applying critical thinking skills in their nursing practice. And because we also follow a principle called adult learning theory. Therefore, we want our nursing students to apply adult learning theory when they are practicing nursing care. So these are the student learning outcomes. I am projecting the student learning outcomes mainly with the purpose that we should make sure these student learning outcomes are integrated into the OSCE as well as simulation scenario when we are preparing the scenario for our nursing students. So let us see the definition of simulation. Simulation is an activity. Simulation is an activity or event replicating clinical practice use scenarios, high fidelity mannequins, medium fidelity mannequins, or standardized patients, playing, skill station, and computer-based critical thinking simulation. So it is exactly replicating a clinical practice, because we will be creating a simulation in a laboratory where everything is made possible similar to the clinical practice. The scenarios will be having components which are similar to clinical practical scenarios, and we will be either using high fidelity mannequins where the mannequins can respond to the students. Say for example, the mannequins can breathe, they can cough, they can bleed. So many kinds of things can be created using high fidelity mannequins. And medium fidelity means standardized patients. Standardized patients are patient actors. We call them as patient actors. These actors will be acting like patients. So they will be called to the simulation lab, and they will be oriented to the scenario, and they will be made to act like a patient. And by role playing, and we will have skill stations. We will have multiple stations, and the students will be completing each station on rotation, and they will be mastering their skills. And we also have computer-based critical thinking simulation. So by utilizing all these methods, when we give a real-like simulation, real-like clinical experience, it is called as clinical simulation. So simulation-based clinical education in nursing is very much important, because nowadays patient safety is considered as very important. Because earlier, I still remember when we all studied long back in 92 to 96, I still remember we used to go to the laboratory and we used to practice the skills on the mannequins, and the mannequins will not be able to make any movements. It will just lie down Noel. I still remember practicing on Noel, where we'll just go and practice on the mannequins, where we'll just practice only the skills. But the mannequin will not be able to communicate to us, or the mannequin will not be able to respond to our comments, things like that. However, now this simulation, we have many high fidelity simulation as well as virtual simulation scenarios where we can have more realistic simulated experiences, which will enhance the clinical competency and learning of the students. So therefore, simulation-based clinical education in nursing refers to variety of activities using patient simulators, including devices, trained persons, lifelike virtual environments, and role playing, not just handling mannequins. It is not only handling mannequins, it is involving many other aspects, which is really improving the clinical competency of nursing students. A simulation may involve standardized patients, computerized case management scenarios, mannequins, clinical vignettes, and combination of these methods. Either we can use one or two, or we can use many methods together in a simulation scenario, so that the learning will be very comprehensive. So say for example, can we practice CPR or code blue in a clinical setup, which is impossible because it is high stake skills, which is not possible to be conducted in the clinical setup. So therefore, in order to give practice to the students, the CPR as well as Code Blue, such skills can be practiced in the simulation lab, where the simulation scenarios can be created in such a way that the students can practice these skills in the simulation lab and they get mastered in their skill, so that when they go to the hospital, they will be able to directly work on the patients. So that is what simulation is very much important in nursing education. So here you can see various pictures where you can see in the left side, you can see a standardized patient. Actually, they are not real patients. They are actors. They are normal people. They will be called to the simulation laboratory and they will be acting like patients. And the nursing students, also the doctors, learn from the standardized patients. They will be responding like a patient. They'll be talking like a patient, because in the beginning itself, we will be giving the script to the standardized patient, what he is supposed to talk. So therefore, the standardized patient will be ready with the script. With the script, the patient will be communicating to the students and responding to the students. So this learning will make the learning very realistic, and the student will understand it better, and the student will retain the information in a better way. Similarly, if you see in the right side, you can see various low fidelity mannequins where the students can practice some skills on the low fidelity mannequins. Therefore, what I'm trying to say is the students can use both standardized patients, high fidelity mannequins, as well as low fidelity mannequins and medium fidelity mannequins. They can combine any of these together and they can make the simulation scenario more realistic. So in order to make it more realistic, we can combine many types of methods of simulation when we are using it. So this is a sample question where we will be giving to the students. The students, what they will do, they will be reading it and they will be responding accordingly. Say, for example, a 70-year-old obese African American man with a PMH of hypertension, past medical history of hypertension, diabetes mellitus and type 2 diabetes and hyperlipidemia, who has been smoking 1 pack per day for the last 40 years, presented to the ED with sudden onset of substernal chest pain while he was sipping his coffee sitting on his couch. Pain is pressure type, squeezing, and associated with diaphoresis, nausea, and feeling down. So what do you think? This is the question. So you are giving a clinical scenario for the students, and what the students are expected to do, the students have to analyze the scenario. They should identify what is the real problem in the patient, and they should be able to make their own diagnosis. They should be able to do the intervention, whatever is appropriate for the patient, and they should be able to evaluate, as well as they should be able to document the nursing care. The reason why I am giving such a scenario is because the scenario looks like the exact clinical scenario where the student is expected to perform whatever is expected from the scenario. And the students in simulation, the main thing we should understand is the students can make error and learn. How many of the times they want to make error, they can learn till they are perfecting their skills. They can learn it, relearn it, they can demonstrate it and re-demonstrate it, and they can learn it perfectly. Therefore, this is simulation is a better opportunity for the students to make mistakes and learn through mistakes. So learn from mistakes. That is what we are giving such a situation for the students. So this is another sample simulation scenario. A 9-month-old baby girl presents in the emergency room with respiratory distress and dehydration due to diarrhea and lack of fluid intake. She has tachycardia with a heart rate at 162 per minute with increased shallow respirations at 39 per minute. She is pale and drowsy with cold and mottled skin. She reacts irritable to physical stimuli but does not react to voice. She does not cry and her movement is decreased. Blood pressure is 68 bar 54, SpO2, and delayed capillary refill time 6 seconds. So the scenario is given. What we do next? The participants means the nursing students. The nursing students are expected to recognize the onset of compensated hypovolemic shock due to dehydration. They should support oxygen saturation with oxygen administration and restore fluid balance with fluid boluses. This will stabilize the baby. The participant should order further lab studies and consider treatment with antibiotics, communicate the condition to the baby's parents, and keep her for observation. So we are giving instruction to the students. Therefore, using this simulation scenario, whatever is expected from the students also is given down, so that the students are expected to achieve these objectives when they are completing the simulation. So during the simulation scenario, it is not necessary that only one student should be acting in the simulation scenario. There can be 3 or 4 or 4 to 5 or 5 to 6 students can act in different roles. Say, for example, one student can act as a nurse, one student can act as a patient, one student can act as a caretaker, and one student can act as a doctor. They can act, each one of them can take different roles, and they can act, and they can, so every 6 of them can be evaluated by the instructor, because all 6 of them are involved in one or the other way in the simulation scale. So every one of them can be evaluated using a global rating scale. The student can be evaluated on their performance. So what I'm trying to say is the simulation as well as OSCE can be evaluated. So it is not only simulation is a method of teaching, but during simulation also we can evaluate the students' performance. So the rationale for simulation in nursing education, because it ensures patient safety, because it is not possible in the real setting. In the real setting, say for example, I still remember when I was a student, I saw one nurse. She administered a soda bicarb injection. Actually, she administered. She wanted to go for a break. Then this particular nurse, administered this soda bicarb injection quickly, and she went away from the area. Then suddenly, because I was the only one who was there in that particular post-operative ward, and I still remember that patient suddenly developed cardiac arrest, and the patient started gasping. So when the patient started gasping, and I was a second year student, I do not know what to do and how to go ahead. Then I started giving CPR, and I was not aware how to handle the situation. Then I started giving CPR, and I called the head nurse and somebody around, and they they rushed into the hospital ward. Finally, within a short span of time, within just 3 to 5 minutes, the patient passed away. Because then that particular time I was not knowing what happened. Actually, the nurse gave an injection. Because of the injection, the patient died. What happened actually is soda bicarb injection. Then the head nurse, she asked me, oh, how was the injection given? Who gave? Then I said the sister gave. Then she asked, how did she give? I said she quickly gave and went. Thereafter, she explained to me, see, you are a nursing student, you should understand the soda bicarb injection is supposed to be given very slowly as a slow IV. It should never be given as a fast IV, because it will cause cardiac arrest. That is the reason the patient died. See, this is a patient safety, because though she was a nurse, she was not aware of the steps to be followed while giving an injection. But what will be the situation of the nursing students? Because nurses have experience, but nursing students do not have experience, and they can when they go to the hospital and they try make an error, it is affecting patient safety. So therefore, during simulation, repeatedly we can do mistakes, and we can learn, because when we do mistakes, our teachers will correct, and through that we will be able to learn. Therefore, I am saying simulation is best in order to ensure patient safety, so that we will not threaten the patient safety in this lab. When we get adequate practice in the lab, when we go back to the clinical, we will be able to give proper nursing care to our patients, and to promote better preparation of new nurses, because when we have a role of transition from the student to the graduate nurse, because during the student period, we are learning different courses. Say, for example, maternity nursing, pediatric nursing, psychiatric nursing, but we never have opportunity to be an independent nurse in a particular ward. Therefore, we will not be able to be competent in all the skills, whatever we have learned in our nursing profession. So, unless and otherwise we have more and more practice in the simulation, we will not be able to competently give nursing care to the patients. Therefore, during the transition from the student period to the graduate nurse, the simulation will help the nurses to help us to prepare better nurses for tomorrow. So especially during the induction as well as during internship, the students are given hands-on experience for having more practice. However, now simulation is introduced, and simulated environment is given to the nurses in the induction period also, so that they learn perfectly and they go to real clinical practice. As well as it is a new innovative teaching strategy, so that we can adopt in our nursing education as to overcome faculty and preceptor shortages and lack of clinical sites. Because some of the institutions do not have parent hospitals where the students may not have adequate practice. Therefore, when there is a shortage of faculty as well as preceptor, we can use the simulation lab to have more practice for our nursing students, as well as to provide immediate feedback. Because when the students are doing some skills or when students are practicing, we can give immediate feedback when they are making mistakes, so that the students will correct those mistakes and they will repeat it again. Till they are competent, they will repeat it again and again, and then they will be perfecting their skills. And to ensure repetitive practice in learning, so practice maintains, because they are able to practice many times in simulation lab, so that it enhances their clinical competency. Also, it helps to integrate simulation into the curriculum to adjust the difficulty level. Say, for example, the difficulty level of simulation can vary from level 1 to level 4 courses. For example, level 1, we will be learning fundamentals of nursing, health assessment, some basic courses. So the complexity can be adjusted in level 1. However, when the student come to a level 4, we can give more complex cases, more complex scenarios where the student can really apply her mind and she can identify the real problems and she can solve the problem using the simulating environment to provide opportunity to individualize learning. So here the students are getting opportunity to learn one-to-one on simulated patients so that they are learning in a proper way. Also, it helps nursing students to develop effective non-technical skills, practice rare emergency situation, as well as they can handle a variety of life-threatening situation. It is possible only in a simulated environment, because we cannot try life-threatening situation or non-technical skills. It cannot be just like that. We can practice in the real clinical setting. However, it is possible with simulation. So simulation-based educational interventions